So let's talk a little bit about what it looks like to leverage technology to help us mitigate some of these workforce challenges, improve quality, improve access, and improve the way care is delivered. Now, this was a survey that was conducted in '08, and it's a seminal survey because what this really did is it started to ascertain how much time are nurses spending on nursing functions. And oftentimes, when we think about nursing functions, we think about patient care, care coordination, administering medications to patients, assessing patients. We don't think about documentation as being a nursing function. It is important for us to document what we do. And at the same time, we see that documentation has overtaken everything else that we spend our time on. This is something that deserves an incredible focus because we've got to find ways to shift that number and decrease it. We can't continue to spend all our time on documentation. Now, what I'm going to say is that this is absolutely an opportunity for us to adopt the technology that's available today, particularly artificial intelligence. There are some amazing things out there that will help us as we begin to shift into a different way of doing things. Now, this is a really neat slide, and what this really gives us a sense of is as we think about adopting technology, this is focused specifically on artificial intelligence. So, when you think about the platforms that are available today, what are the benefits that those bring to us as medical professionals, as nursing professionals, and what's the impact on patient care? So you can begin to see there's a lot of really great stuff this does. It helps us with clinical documentation, radiology interpretation, treatment plans, triage, summarizing research papers. When you think about our ability to access Copilot, Perplexity, Claude, ChatGPT, those systems are out there and available to almost everyone around the world. Think about how you can utilize even the free models of AI to help you summarize research papers, do data analysis. How can we help use those tools that, again, many of those are free? How can we help them use that with our patients? Can we summarize patient education material and make it easier for them? Can we help to create medication compliance and medication administration education so our patients know what they're taking and why? We can help those patients with those tools that are available, even summarizing laboratory results. If you take a set of labs and you drop it into Perplexity or GPT or Claude and ask it to provide patient education based on the lab values, it absolutely will do that. So think about how you can use the tools that are available to you today and actually simplify things or improve the care that you're providing. Now, if you're in a hospital or if you're in a health system, you need to ensure that you're utilizing the tools that are available to your hospital. We do not want any breaches of privacy or confidentiality. So work within your systems and follow your local policies and procedures and talk to your information technology team, your information services team. What are the tools that you have available that might benefit you as you're looking for ways to simplify and streamline processes as you administer care to your own patients? Now, we're going to take a second to talk about some studies that were done in the United States. These are really great studies. They are free, they are accessible to you. If you Google, you'll see down here in the lower left-hand corner the McKinsey and Company studies. They were done in conjunction with the American Nurses Foundation. And these studies did a great job. And I've only taken a couple little snippets, but they're quite robust. These studies really begin to provide some insight into what nurses think about utilizing AI in their work processes. And you'll see that the answers are broken out by age. So we see under 30, 30 to 39, 40 to 49, 50 to 59, 60 to 69, and greater than 70. And if you look at these, the question in this particular data set was majority of nurse respondents reported desire to see more AI incorporated into their work. And you'll see the three choices, they were, I'd like to see more AI tools used. And the group that responded with the most excitement around that were 30 to 39-year-olds. The group that responded with the most uncertainty in that is certainly those that are over 70. We have to begin to wonder if some of the generational differences around technology adoption might be a bias here. We don't really know that. We also looked at the choice of what we have now is enough. And again, you'll see it's interesting because among our nurses that are more tenured, 25% in the cohort of 60 to 69-year-old nurses said what we have is enough. And we see that 30 to 39-year-olds, only 19% say what we have is enough. So again, you'll see that there is a zeal for adopting technology among this 30 to 39-year-old group. It's interesting to me that we didn't see more excitement in those under 30. So I'm not sure what that's reflecting. We also looked at the choice of I'd like to see fewer AI tools used. And again, interesting that the lowest number shows up in the 30 to 39-year-olds, and the highest number at 21% shows up as those nurses that are over 70. So something for us to think about as we continue to look at how we're going to adopt technology as we have to digitally transform the care that we provide. Now, here's another really neat question. And what this looks at is the trust in accuracy, lack of human interaction, and insufficient knowledge on how to use AI. So you can see here that when we look at this, there are some really interesting data here. So we see that trust and accuracy really is the question that certainly gets the highest response of concern. When we look at lack of human interaction, that's the second. And what's fascinating here is that there is an automated assumption that we all have as nurses that says if we use more technology, that must mean that the trade-off is less human interaction. In fact, that could not be farther from the truth. So really, what we see here is that people are setting a choice in their mind that says it's either technology or human interaction. And that's not true. This is not an either or, it's an and. We absolutely need to have human interaction, and we need to leverage technology because we know that our workforce challenges are significant. And you can see as you go down this list, lack of knowledge on how to use, we absolutely are going to have to educate not only nursing students and medical students, we're going to have to educate incumbent nurses, existing residents, existing physicians, existing nurse practitioners on how to use AI, how it's developed, how to watch for biases. So these are things that we're going to have to build into how we create the workforce, not only of the future, but how do we upskill the workforce of today? Usability is interesting because this really goes to it has to be easy to use and intuitive in order for clinicians to use it and leverage it. We look at bias, we look at lack of time. From a lack of time perspective, as we develop tools that are much more intuitive and built into our current processes, it should not be 1 minute more time. It should actually save time. And that's part of how we have to ensure that technology works. It's also part of how we have to educate our workforce. Now, this is also a really fascinating slide with some cool data on it. And what's interesting here is to think about how do we ease the doubts about AI? And we are looking at the input on technology design, development, quality, and safety. And really what jumps out us at us is nurses need to have the input into the design and development of these tools. That's kind of a non-negotiable. We have to make sure that we are involved in that. Well, how do we do that? This is where, when your organization is beginning to explore technology, we absolutely have to make sure nurses and nurse leaders are involved in that. And sometimes we also have friends and colleagues, or we're aware of startups asked to get involved in the design, the development, the utilization of their tools, their technology, and their products, because it's so important that we have input into how these are developed. And you'll see a lot of these different data point questions and choices here really talk about what is the involvement of nurses and how do we increase that involvement. And zero nurses said, I don't think there's concerns. So, what that really reflects is a high interest on the part of nurses to be much more involved in the design and development of how these are used. Now, we also want to think about this because we cannot just jump into AI blindly. We have to really think about what's the impact to nursing practice? What's the impact to safety? What's the impact to patients? And artificial intelligence should not, cannot, will not replace nurses. We will exist as the human beings that will be touching the patients, providing the patients with medications, being the direct eyes and ears to be there with the patients. That's not going away anytime soon. Anytime soon. In fact, there was a book written, The Fourth Age, and it was written about 8 years ago. And there's actually a section on robots, and it talks about the fact that nursing is going to be one of the most difficult professions to automate through robots. And the reason for that is because our tasks are not repetitive and redundant. And we are so human focused through empathy and compassion that it really is going to take 15, 20, 30 years to come up with robots that could truly, truly begin to take over so many of the tasks and the workflows that nurses do. So this is not something that I would be concerned with at this point in time. I would suggest we think a lot about how we're going to adopt technology, what that means to nursing practice, and what that means to our patients.